Hello everyone, I'm Dr. Matt Reddy. Thank you so much for tuning in to my video blog. I want to talk today about another digestive issue. And the reason I want to talk about this is because it may be something that's going on for you, especially if you feel like you have Candida. A lot of my patients are dealing with Candida or think they're dealing with Candida, and we have to do quite a bit of diagnostic work to actually figure out what's going on for them. And what I want to talk to you today about is a condition that affects your small intestine. It's a condition called SIBO, small intestinal bacterial overgrowth. And people who have SIBO have symptoms that look like any kind of digestive problem, especially Candida. So you could be thinking you have Candida issues, but what you maybe have going on is actually SIBO. And you could also have Candida at the same time, but SIBO may be the cause of your Candida not resolving. SIBO is an overgrowth of bacteria in the small intestine. And most people are familiar with the idea that our digestive tract has a lot of bacteria in it. However, most of those bacteria actually live in your large intestine. The large intestine has a ton of bacteria, but the small intestine really does not have very much at all. And if it gets out of balance, if there's too much of the bacteria growing in the small intestine, you're going to get digestive symptoms. The most common symptom that people with SIBO experience is bloating, especially after eating. Other symptoms are going to be things like reflux, maybe some flatulence. You could also have constipation and occasionally diarrhea. And the reason these symptoms are there is because as the food is moving through your digestive tract, through the small intestine, the bacteria that are there that shouldn't be there are feeding on that food. And they're preventing you from absorbing it correctly. They're also releasing a lot of gas. And that gas builds up in your intestines and causes all kinds of symptoms. It can even cause chronic pain. I have a few patients that actually have been diagnosed with fibromyalgia, and it's actually an issue with SIBO. So you have got to get this diagnosed correctly and treated correctly. And to do that, it's very simple. The simplest thing you can possibly imagine for a diagnosis, and it is a breath test. When you have this bacteria in your small intestine and it's feeding on the food that's going through, it's releasing this gas, which is absorbed into your bloodstream, and that blood goes to your lungs, and that gas is released, and you breathe it out. And so we can detect it by doing a breath test. If there's no bacterial overgrowth, then there's really not very much gas detected. If there is a significant amount of bacterial overgrowth, then we're going to see patterns of these gas levels will go up, and that will be a positive test for bacterial overgrowth there. And from there, you really have to treat that infection. You have to get that balance back, and you have to heal the small intestine. And that's an extremely important thing to do correctly. You have to find someone who knows what they're doing. Otherwise, all the symptoms just come back, and you're back to square one. So I hope this was helpful. I wanted it to be a little bit of an update on my Why the Candida Diet Doesn't Work video. And I'm hopeful that it can be information that you can use if you're still having trouble with any of these stubborn symptoms. So leave comments below. Thank you so much for watching, and I wish you guys all the best. Thanks.